Dry eye is a huge problem for so many of our patients. I'd say almost 1 in 4 of our patients are coming in with some level of dry eye symptoms. And oftentimes, we have, patients that are very stoic and they don't really want to complain about some of the symptoms of dry eye. But in some way, shape, or form, we're all susceptible to having, symptoms of dry eye. Maybe it's not every day, but it's certainly, certain environments. We're all tied to electronics. There are cell phones and computer, and windy or dusty environments all can have certainly contributing factors to give people symptoms of dry eye. And sometimes people aren't really that in touch with how they're feeling in terms of feeling sandy, gritty, noticing fluctuation in their vision, having red eyes. They don't always associate that with dry eye. So certainly in addition to diagnosing people with dry eye, we try to come up with a manageable treatment plan for each patient. And it very much sometimes has to be tailored and made accessible for everybody and their lifestyle. Dry eye, it's a spectrum. People with very mild dry eye to very severe dry eye. And we really try to have resources available than just throwing a handful of artificial tear bottles at every patient. Certainly now we're discovering so many patients are really searching, for a good solution, and having a dry eye spa gives us the resources to really focus on that one condition. There's a higher prevalence with women versus men. It certainly is a little bit more common as we continue to age as well, although young and old can have dry eye symptoms. There's certain patients that we see a lot that for whatever reason have inflammatory conditions or autoimmune conditions that can contribute to dry eye. Certainly dry eye has been linked to not only diabetes, but Sjogren's disease, which is a disease that usually presents with people with profoundly dry eye or dry mouth, dry skin, rheumatoid arthritis, irritable bowel syndrome. These are other autoimmune conditions that aren't often thought of as having connection with the eyes, but very, very common to see people with that kind of condition experience dry eye. In addition to thyroid disorders, which affects so many people, and sometimes certain dermatological conditions are linked to dry eye as well. People that have had eczema, rosacea, psoriasis, those are inflammatory skin conditions that also have been linked to people that are fair skinned and also linked to dry eye.